She lied to me to protect her workers' comp. That lie cost her her life. I'm Dr. Robert Friedman, doubly board certified in internal medicine and infectious diseases and in private clinical practice in Miami for over 40 years. And I was an infectious disease fellow in training. We had a woman in her 40s who presented to the emergency room complaining of 2 to 3 day history of fever and shaking chills. She had no symptoms that would allow us to identify the focus. For example, she didn't have a cough, she didn't have burning on urination, she didn't have abdominal pain. So we couldn't find the focus. So we admitted her for observation. As the days went by, she continued to clinically deteriorate. We repeatedly asked her all kinds of questions. Have you traveled anywhere? Have you taken any new medicines? Do you have any medical history of any problems? And everything was no, no, and no. When she deteriorated to the point of becoming unresponsive and having to be put on a ventilator in order to breathe, her sister approached us, distraught, saying that my sister didn't want to say anything and tell the truth. And I know you've asked her 100 times if she did travel, but she cannot travel because she's on workers' comp and she cannot leave the area. But a week and a half ago, she went to Africa to visit our family. The minute she said that to us, we immediately took her blood downstairs to the laboratory and performed a thick and thin smear looking for the malarial parasite, which there was no reason to do if she never left the United States of America. And there it was. We immediately started her on anti-malarial drugs, but unfortunately it was too late. The disease had progressed to the point where we couldn't save her, and she passed away. The reason I'm telling you this heartbreaking story is you must be honest with your doctor, because diagnosis is dependent on a good history and a good physical examination. And the history is given to the doctor by the patient. If they hide information, the results could be catastrophic, unfortunately, as in this case. I'm going to be sharing more stories and lessons from my over 40 years of practice. So if you want to learn more, be sure to follow me.